Welcome, everyone. Thanks for joining us tonight. We are going to get started in just a few moments, probably right around the top of the hour, maybe 7:01. So thanks again for joining us, and we will be with you shortly. Hello again. Thanks for joining us tonight. We have quite a few people logging on right now, making sure they're in the right place. So we're going to get started right at about 7:01. Thanks for your patience. Hi, thanks. A few more people have joined. We're just going to give it 1 or 2 more minutes before we get started. Thanks again, everyone, for joining us this evening. A handful of people have continued to log on. We're just going to wait 1 more minute, making sure everyone finds us here before we get started. Thanks for your patience. Thanks for joining us this evening. We're going to go ahead and get started. So good evening, everyone, and thank you for joining our Men's Health webinar. I'm Brittany, and I will be your host and your moderator. We'll start with a few housekeeping items, and then I'll introduce our speaker. First, your attendance tonight is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, please type it in the chat box at the lower part of your screen, and we will be sure to include them during the Q&A session after the presentation. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Doshi. Dr. Doshi treats patients with a wide range of urologic conditions. He performs minimally invasive surgery, including endoscopic surgery and robotic surgery for various urologic diseases. In the office, he performs minimally invasive procedures for prostate-related voiding difficulty, as well as vasectomies. He is cognizant of how urologic problems can significantly change a patient's quality of life. He is committed to diagnosing and treating these conditions, utilizing both non-surgical and surgical methods. I'll go ahead and turn it over to you, Dr. Doshi. One second.
Let's see. Thank you, everyone, for joining. Let's see if this works. There you go. that's just my contact information. And so we'll cover just the basics of, what the prostate is, what does it do, and then kind of go over, what BPH means. And then we'll go over some of the treatment options, available to treat BPH and its associated symptoms. So the prostate is a walnut-sized gland at the base of the bladder. Let's see if I can... so it's a walnut-sized base at the base of the bladder. It surrounds the urethra through which the urine comes out. It produces fluid that transports the sperm during ejaculation, and the prostate grows to its normal adult size in a man in the early 20s, and then it begins to grow again in the mid 40s for most men. So what can happen to the prostate? Each condition affects the prostate differently. One is an enlarged prostate, or what is commonly referred to as benign prostatic hyperplasia. You can get prostatitis, which is an infection or inflammation of the prostate. And lastly, prostate cancer. So going over BPH, BPH essentially just means, benign, so non-cancerous, prostatic relating to the prostate, and hyperplasia, meaning more cells than normal. It's also known as benign prostatic enlargement. And normal adult size of the prostate is about 1.5 inches in diameter. And when the prostate, grows, it can obstruct the urethra, which is called the bladder outlet obstruction. And that's what causes lower urinary tract symptoms, such as frequency, urgency, weak stream, things like that. So does BPH mean you have prostate cancer? No, BPH is not prostate cancer, and BPH does not cause prostate cancer. BPH is essentially overgrowth of cells that are on the central part of the prostate where the urethra is. And prostate cancer traditionally will grow on the outside sections of the prostate. So kind of different conditions, but symptoms can be similar, and both conditions may coexist with each other. And PSA levels alone cannot help you distinguish, between an enlarged prostate versus prostate cancer. So you do need, further testing to help evaluate that. So the normal versus enlarged prostate, here you can kind of see a normal prostate with an open urethra. And then as the prostate enlarges, it puts pressure on the urethra, thereby compressing it. And that's what leads to symptoms. And prostate size does not correlate with the degree of obstruction or your severity of symptoms. You have patients with small glands who have very severe symptoms, and patients with massive glands who don't have any symptoms at all. So it kind of just depends on your body and your anatomy. So what are the symptoms of BPH? And most of you are probably familiar with some of these, frequency of urination, either during day and or at night. A sudden urge to urinate, where you always know where the nearest bathroom is. Having a weak urine flow or a urine stream that's going to start and stop on its own, or where you have to strain to empty the bladder. And once you're done urinating, you feel the sensation that your bladder is not empty. And lastly, if the condition gets really severe, you just have an inability to urinate, which is called urinary retention. So BPH can affect, quality of life, understandably so. Many men who suffer from BPH will, experience, some reduction in quality of life. Up to 95% of men with moderate symptoms are unhappy, and they don't want to spend the rest of their lives with these symptoms. Studies show that 49% of men experience sexual problems associated with these symptoms. And about half of men will say that BPH interferes with an aspect of their normal life. And BPH also affects a man's partner's quality of life, your daily routines, your relationships. If you have, issues with, voiding, you're going to the bathroom a lot, that's certainly going to affect, how your day goes, and for how everyone around you is affected with that as well. So who can get BPH? BPH is the most common prostate problem for men over 50. Yeah, the prostate traditionally, helps with the reproduction aspect. And, once you're done having kids, it really only, I joke with my patient that it only causes you problems as you get older. Up to 50% of men are going to be affected by BPH by the time they turn 60, and almost 90% of men by the time they turn 85. So really very common problem. In 2010, as many as 14 million men in the US had symptoms, and obesity, weight gain, or having a higher BMI, lack of exercise, things like that could increase the risk of getting BPH. So how do we diagnose this? One is just an exam. We do a rectal exam that helps us assess the size or estimate the size of the prostate. It also helps us look for prostate cancer. And then you can do some testing to figure out, whether the urine truly is being obstructed by the prostate. And that can be done using a urinary flow test, or it can be done using a urodynamics test. And something that we do more commonly in clinic is to measure your post-void urine volume, where we scan your bladder after you're done urinating to see if you can empty your bladder completely. And then the other part is, self-evaluating your symptoms. So if you've seen us in clinic, you've noticed that we, give out a questionnaire if you're coming in for a BPH-related complaint. And that kind of helps us understand, how severe your symptoms are, and use a standardized scale to kind of help guide treatment options. So now let's go over some of the treatment options. So the first thing that we always try is to do, behavioral modification. We'll ask you, questions about, fluids and diet, and see if there's anything we can do to change your fluid intake, which would in turn improve how much urine you make and how you urinate. We can also potentially do exercises like Kegels or pelvic floor muscle exercises to help strengthen that area, and see if that helps. And if that fails, the next step is medications. So we, traditionally would do medications such as Flomax and finasteride. I think we'll get into those details soon. And then if those fail, the next step would be to consider some kind of procedure on the prostate. One question that we, patients, we usually get is, can any dietary supplement, help me with this issue? There are certain, dietary supplements that you find over the counter, especially saw palmetto, but the data really is mixed on it. And really there's none of those are really recommended as a management to treat symptoms secondary to BPH. Watchful waiting is just, as the term implies, you just kind of, make some changes in diet and behaviors and fluid intake, and other medications such as, diuretics that you're taking for high blood pressure or heart issues, and kind of see if that overall, gets you to the point where you're happy with your symptoms. The very low percentage of patients will see a true benefit from doing just this. The potential side effects of that is the symptoms may worsen, or they just may not change. And if your prostate continues to grow, then you may have reduced your options for a minimally invasive intervention that we could potentially have offered when the prostate was smaller. Medications wise, alpha blocker or Flomax or tamsulosin is one of them. That's one of the first few medications that we will prescribe to help you with your symptoms. This medication helps to relax the muscles in the bladder and the prostate, allowing the urine to flow more freely. The side effects of tamsulosin or alpha blockers is it can drop your blood pressure, it can cause some dizziness, it can cause fatigue, and it may interact with some of the other medications that you're taking. If you look at the data, majority of men will stop taking the medication within a year, either because they don't want to take one or two, medications extra every day, or the medications are just not working. Second medication is a 5-alpha reductase inhibitor, or finasteride is the more common one that's used. These medications are designed to stop the growth or even potentially shrink the prostate. And it does this by lowering this hormone called DHT, which is a male sex hormone. So as expected, then the side effects are going to, change. It actually can cause erectile dysfunction, a lowered sexual drive. It can cause ejaculatory issues, and it can potentially even cause breast enlargement in males. Again, once you consider the side effect profile and the need to take medications, majority of men will stop taking this, around a year from when they started. So now you kind of get into some of the minimally invasive, treatment options to treat BPH. One of them is called Rezum water vapor therapy. This is an outpatient therapy that uses natural energy stored in water vapor to shrink the excess prostate tissue. The benefit of this is that it does not require general anesthesia. There's no permanent implants. You're just essentially using water vapor to burn away or vaporize that tissue. And when you look at the surgical retreatment, so what are the chances that you need another treatment, down the line? At about 5 years is about 4.5%. So kind of on the lower side. In terms of side effects, it can cause painful or frequent urination, blood in the urine, blood in the semen. Some of these symptoms, tend to get better as the prostate continues to heal after the procedure. You can see a decrease in ejaculatory volume, but that's a pretty low risk. You can get a UTI just like with any other prostate procedure, and we give antibiotics to prevent that. You may have an inability to urinate afterwards because of either swelling in that area or issues with the bladder muscle itself. Or you might have an urgency to urinate. But again, most of these symptoms tend to improve as you continue to heal after the surgery. So here, you can kind of see, an enlarged prostate here on the schematic. And then after Rezum, you can see an open urethra. And I think there's a video here. Let's see.
Rezum water vapor therapy is a non-surgical treatment for BPH. Rezum uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Rezum is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Rezum therapy lets you quickly return to normal activities. Talk to your doctor about Rezum if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
All right. And this is just a quick patient testimonial. In general, pretty well tolerated procedure, and majority of the patients, would recommend it to somebody else with similar symptoms.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Rezum when I was researching enlarged prostate and the procedures to repair it, to fix it. And Rezum was one of them. The more I researched Rezum, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Rezum procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Rezum procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezum treatment has made a very big difference in our life.
The next procedure that's available to treat BPH is the prostatic urethral lift, and one of the common brand names is Urolift. This is also an outpatient procedure that utilizes permanent implants to lift and kind of hold that prostate tissue out of the way, so it no longer blocks the urethra. So the end result is the same, where you're, relieving the obstruction and making the urethra open again. It also does not involve general anesthesia, but it does involve putting in implants or, a foreign object into the prostate. And it has a higher retreatment rate at 5 years, about 13.6%. Side effects are, very similar, except you can potentially get pelvic pain. You can get stone formation on the implant itself, and you can have painful ejaculation. So just a little bit different than what we had covered with Rezum. The next option is green light laser therapy, or PVP, or photovaporization of the prostate. This is actually done under general anesthesia. Here you use a laser to kind of vaporize or burn away the prostate tissue. Once again, it's not a permanent implant, and the surgical retreatment rate is also lower at 4.8%. With this procedure and the next one that we'll cover, the side effects, outside of the infection, the bleeding, and some of the urinary symptoms as the prostate is healing. The difference really is it can have more bleeding. You can actually have leakage of urine as that area continues to heal, or if the sphincter that keeps you continent gets damaged. You can have scarring or narrowing of the urethra as that area heals. You can have narrowing of the bladder neck, so right at the junction of where the prostate and the bladder meet. And probably the more common ones that bothers patients is the, symptoms or side effects associated with erection. So it can cause erectile dysfunction. It can cause a dry orgasm, or basically when you have an orgasm, instead of the ejaculate coming out of the tip of the penis, is going back towards the bladder, and that can be bothersome to a lot of patients. That doesn't happen with those procedures that we discussed that are done in the office. like you can tell, it's a similar end result with, kind of unobstructing the urethra, just done a different way. And next treatment is a transurethral resection of the prostate, or TURP. This is one of the oldest, procedures done to help patients with BPH. It's been around for a long time. Here, it basically involves using a heated wire to actually cut that prostate tissue out of the urethra. So it's also done under general anesthesia. Again, no permanent implant. And the surgical retreatment rate is also low at 5.8% at 5 years. Very similar side effect profile to the green light laser, like we discussed, except here, the patient, you have to usually stay in the hospital for a night. With all of the other procedures, you don't really have to do that. Lastly, prostatectomy. So here, usually for prostate cancer, you may hear the term prostatectomy, which is removing the entire prostate. Here, what we mean by that, it's something called a simple prostatectomy, where we are essentially removing only the part at the center, like I explained before, the part that causes issues with urination. These days, it's usually done using a robot. And it's reserved for men who have massively enlarged prostates. We're talking about, a 200 cc prostate, whereas normal is like, 30 to 40 cc's. For this, again, you need general anesthesia. And because you're really kind of removing all of the tissue in that area, the retreatment rate is even lower at 2.7% at 5 years. But that said, it is a major surgery, and the risk for bleeding and blood transfusions are pretty high. You're in the hospital for a few days. So that's something to consider. And it's really not something that everyone would be a candidate for. In terms of insurance coverage, most of these procedures, especially Rezum, are covered well by insurance. But of course, you can check with the insurance company to see if they would cover it. So just in summary, we went over what the prostate is, how it works, how it causes urinary tract symptoms. An enlarged prostate is called benign prostatic hyperplasia, or benign prostatic enlargement is the new term. And in terms of treatment options, we can either just figure out behavioral things to change, or we can try medications like tamsulosin and finasteride, or we can consider doing office procedures such as the Rezum and the Urolift. And lastly, surgical procedures, or something that's done under general anesthesia, would be the green light laser, the TURP, and the simple prostatectomy. So next steps, if this is something that's bothering you and you're interested in finding out more, ask your urologist to see, what therapy would be best for you. It kind of just really depends on you, on the size and shape of your prostate. So there's a lot of factors to consider before recommending the optimal treatment. So, talk to your urologist next time you're in office, and they can help you out. So we'll take some questions now.
Awesome. Thank you so much, Dr. Doshi.